Greetings from Sree Balaji Medical College, Department of Pharmacology. I am Dr. Brigida, Assistant Professor in Pharmacology. You learned about terminologies of pharmacology, and today is the second session. It deals with the route of administration. So drug is available in different dosage forms. It has to be given in a specific route. So this covers pH 1.11 and pH 4.1 of CBME curriculum. So drug as it appears in a different formulation. So how we choose the route determines the outcome of the treatment. So it is not only the drug, it is the route which we prefer determines the best of outcome, how we treat the patient. So this session deals with what are all the merits and demerits of a particular route and factors governing how we choose that particular route for that particular patient. And also there are newer drug delivery systems. We have conventional mode, and also evolution is a process of human being, and the dosage forms and route of administration have been evaluated. But since it's important that we learned about the conventional thing to go ahead with the newer system, so this topic deals with the conventional mode of route of administration. Route of administration of drug means the path through which the drug is administered to reach the site of action. The choice of the appropriate route in a given situation depends both on the drug as well as the patient-related factor. So let us learn about the factors governing choice of route. Number one is physical and chemical properties of the drug, that is whether it is a solid, liquid, gas, or whether it is soluble, and irritancy of that particular drug. Second is site of desired action, whether it is localized or generalized, that is systemic. So third is extent of absorption of the drug from different routes. Fourth is effect of digestive juices and first pass metabolism. So first pass metabolism, as you learned, it happens in liver. Rapidity with which the response is desired. So whether it is a routine treatment or you are choosing the particular route during emergency. So accuracy of dosage required and inhalational can both be tuned. So condition of the patient. These are the factors which governs the choice of route. So let us move on to the classification of route of administration and time until effect. So route of administration can be classified into systemic and local. In systemic, it is enteral and parenteral. Par is beyond enteral. So in enteral, it is oral, sublingual, rectal. So parenteral, it has inhalational injections and transdermal. So local, it is skin, topical, then intranasal, ocular drops through mucosa, whether it is in throat, vagina, or mouth or ear, and inhalational and transdermal. So in parenteral, all the injections will come. So intraosseous, intraarticular, intravenous, or endotracheal, everything comes under this parenteral. So beyond GIT. So the route of administration, time until effect. Why we choose that particular route? Because it acts better and very fast through that particular route. So in case of emergency, I hope you all can understand it is through the intravenous we prefer. If not accessible, then we can choose the intraosseous route. Let us deal with the individual route and let us move on to oral route of administration. Oral administration has both local effect, that is for example antacid, because in gastritis we need to neutralize the acid, Then in systemic effect, so it has to reduce our temperature, for example, paracetamol. So site of action is swallowing the drugs through the mouth, and different formulation used through the oral route is tablet, capsule, syrup, aqueous solution, mixtures, and etc. So merits about this oral route is most commonly used method, and everyone know about it, and most of the other treatment modules also rely on this. For example, Ayurveda, Siddha depends on this, and safe and more convenient, self administration possible, no pain, it is cheap, and sterilization of drug is not essential. So, demerits of oral administration is action of the drug is slow, so hence not suitable in emergency. So, if the drug is irritant, so it will irritate the gastric mucosa and produce nausea and vomiting, and it can't be given in vomiting patient and those patients who are unconscious. So cooperation from the patient side is very important. So it is not a suitable mode in children and in elderly patients. So certain drug is destroyed by gastric juices. So that formulation is not at all available. So for example, insulin, which would be digested by the gastric juice, and inhalational insulin is on trial. So certain drug is not at all absorbed through oral route. Example is aminoglycosides. And the drug which have got high phosphorus metabolism cannot be given by this route. For example, nitroglycerin and testosterone. So we move on to sublingual or buccal route. So it is an emergency preferable route because it produces 100% treatment effect. That is, bioavailability is 100%. So site, as the name suggests, sublingual, behind your tongue, and buccal route. So the tablet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. Example, nitroglycerin, and you might have watched movies where when patient is suffering with severe chest pain, some drug is kept under their buccal mucosa or under the tongue. So dosage forms, capsule and tablets, dispersible tablets are available. So merits of the sublingual route is quick onset of action, since the blood supply is more in sublingual area and it bypasses the liver, and 100% bioavailability. After the desired action, the extra drug can be spit out to avoid toxic effects, and self-administration is possible. Demerits of sublingual administration is only lipid soluble and non-irritating drugs can be given. Distasteful and irritant drugs cannot be given, and high molecular weight drugs like insulin cannot be given through this route. Move on to rectal route of administration. It has both local effect and systemic effect, and hope you all have seen a kid who is suffering from fever will be given a suppository rather injection. So children, we don't prefer giving injection, and we give suppository for even febrile patients to avoid convulsion. So suppository available is diazepam and paracetamol. So it is a conical shape. Even ointment is also available. So for hemorrhoids, piles patients, so we prefer ointments. What are all the merits of rectal route can be useful for patient having nausea and vomiting, and if the drug is gastric irritant, it can be given through the rectal route, and useful in children in whom injection is difficult. So demerits of rectal administration is inconvenient and embarrassing. You can see this picture. So how self administration is also embarrassing, and how if we do also, how the patient feel. So rectal inflammation from irritant drugs, and self administration is difficult. So ending the enteral route, we enter into parenteral. So par, as I said, it is beyond GIT. So this picture depicts what are all the injections and in what layer it pierces and how it will be given. This picture depicts it, and as you see, intramuscular, you hold it 90 degree, and in subcutaneous it is 45 degree, and intravenous it is 25, and intradermal so flat 10 degree. So merits of parenteral, this is a general merit which includes subcutaneous, intramuscular, intravenous, intraosseous and intraarticular. So useful in unconscious and uncooperative patients. This route is preferred for those drugs which have got high first pass metabolism. So it produces rapid action. So drug is absorbed faster from the site of administration. So within 5 to 10 minutes, it reaches the systemic circulation. So you might have seen people giving themselves a subcutaneous injection. Many of your grandparents or parents might be taking insulin injection through subcutaneous route. So entering into subcutaneous route, learned about its site. Hopefully, it can be given everywhere the skin is present, but having subcutaneous tissue. So preferable route which can be self-administered is abdomen or thigh or the deltoid. So merits of subcutaneous route, one thing is it has local as well as systemic effect. So local, we can see local anesthetic, and for systemic effect, insulin. So one thing you should notice is after giving subcutaneous injection, it should not be massaged. So merits of subcutaneous route is possible, self injection is possible, and deep penetration is not needed. So this is not matter to be discussed because now insulin syringes are available. Even the vaccines which are preferably to be given in subcutaneous is not given through the normal injection, but possibly through the insulin syringe. So slower and smooth absorption for longer period, suitable for adrenaline, insulin and morphine. Depot injection is possible. So hormonal injections for long time, it can be given in subcutaneous route, and over the period of months, it can be slowly released. So demerits of subcutaneous route, only small volume can be given. So it is not that of the IV or IM. We can give a voluminous amount to treat, except few things, except it can be diluted, nor we prefer subcutaneous route. So irritant drugs cannot be given, and it should be avoided in shock patients. So hopefully you know why we need to avoid this in shock patient is already the patient is in shock and there is complete vasoconstriction and there is no blood supply. So when the drug need to be taken to the systemic circulation, the patient should have a complete good blood supply. So vasoconstriction happens in shock patient, and if you give in subcutaneous route, the least route which is supplied by blood is subcutaneous, and so it should be avoided. So example, anaphylactic shock, adrenaline should be given through IM route, not the subcutaneous route. So some other routes for subcutaneous is when a patient comes with bronchial asthma, we prefer subcutaneous route of adrenaline administration rather IM route. So only route for adrenaline is in shock patient is IM. So move on to intradermal injection. So how many of you notice a scar in your left arm? So that signifies that you are vaccinated for tuberculosis, right? So it is very important to travel across nations. So that injection is given through intradermal route. So drug is injected into the skin or multiple puncture of epidermis through a drop of drug is done. So mass inoculation. So, and one more thing is previously we prefer giving antibiotics after test dose. So, that is not happening nowadays because we dilute it in IV form and small amount is given through IV itself. But most of the conventional treatments and most of the doctors rely on antibiotic as a test dose through intradermal route. So as of now, one thing is BCG and the tuberculin test. So MAN2 is done through this intradermal route. So merit is absorption is slow. So we read MAN2 after 72 hours. So that shows how slowly it is absorbed. So demerits of subcutaneous route is only small volume can be given. So moving on to the intramuscular injection. So this is where skill is most important. So many of the good doctors don't know how to inject through intramuscular route. So if you know where to inject, then it will be very easy to learn the skill. So where we need to give the intramuscular injection is upper arm, thigh. So thigh for children it is anterolateral or preferably through anterolateral in children only and not for adults. So hip and buttocks. So injections, intramuscular merits are less nerve supply, so mild irritant drugs can be given. So more vascular than subcutaneous and absorption is so fast. So depot preparation or long action is feasible. So pen formulations can be given, depot injections can be given. So when the dosage form is oily, then we can prefer IM route. So for example, so vitamin D is an oil injection. So a 6 lakh depot injection can be given once in 6 months. Deep IM. Demerits of IM route is large volume cannot be given. So max is 5 ml. So every IM injection is available only in 6 ml formulation. So when you see a big syringe, so it is not for humans. So just for dilution purpose, we use 10 ml and 20 ml. And 20 ml, as you know, it is for catheterization and not for injections. So damage to the nerve is possible. So if you do an injection that is not appropriate in its position, then you will land up in damaging the nerve. So it is so easy to blame the doctor. So when you don't know where to give, so carefully instill the drug that particular site as mentioned in the diagram. So accidentally, if it enters into the vein, it has toxic effect because some formulations are oily. It can't be entered directly into the IV route, right? So it should be diluted and can't be given. So accidentally, if it enters, it produces toxic effect. So insoluble drugs cannot be given, and as it is so painful. So moving on to intravenous injections. So it is the next step of your skill development. So anyone can't give. Even I've seen so many people struggling taking ABG. So that is arterial, right? So now we are talking about intravenous. If you are struggling to take an intravenous, then how much it will be for intra-arterial. So learn this. So superficial, those who are lean and male have less subcutaneous fat, and it is easy to prick a particular vein. But for the obese, your skill is so much needed. So the site is the median cubital vein or dorsal venous arch. So merits of the intravenous route, so same as that of sublingual, it has 100% bioavailability, preferably in emergency situation. Desired blood concentration can be achieved and larger quantity can be given, and skip the first pass metabolism, and it skips the gastric manipulation as well. So it can be used in vomiting, dehydration patient, emergency patient, shock patient. So demerits of IV route is always irritable and cellulitis. So the apprehension before giving this injection to the patient should be soothed. So it is very important to converse with the patient rather not focusing yourself on giving or instilling the drug. So the feasibility of thrombophlebitis makes it so vulnerable and not preferable for many patients. And repeated injection, it will block that particular cannula, and it is unsafe and it can provoke infection. So technical assistance and skill are required, and less convenience and painful procedure. So we move on to epidural. So epidural it deals with anesthesia because we instill the drug between the dura of the spinal cord and the lining of the spinal canal. So the xylocaine to anesthetize the lower abdomen and lower limb. Most probably you might have witnessed in cesarean section and hydrocele operation. So intra-articular, so at times we can't take intravenous route in unconscious or uncooperative or in shock patients. That time we prefer giving injections through intraosseous route. Nowadays, most of the people suffering from severe arthritis and steroids are instilled through this through the synovial fluid, and it is intra-articular injection. So, moving on to inhalational route of administration. So, most of you might have learned after this COVID pandemic. So, how much everyone is struggling for oxygen. And before that, if when we talk about inhalational, it is about anesthesia and the bronchial asthma. But nowadays, it is even the layman knows the inhalational route is for oxygen. So inspiration happens through nose and mouth. So merits are faster absorption, quick onset of action due to larger surface area of alveoli, and self-administration is possible. So inhaler, nebulizer. So the picture depicts the mask through which oxygen is given, the meter dose inhaler, and the nebulizer. Moving on to transdermal route of administration. So it's considered under parenteral route because patches through applied topically provides a systemic effect. So you might have noticed, so I have mentioned both the transdermal in the topical as well as in the parenteral route. So why it is parenteral is because it has direct systemic entry. So I'm giving you the merits and demerits. So it is slowly absorbed. So depot can be patched and slowly it penetrates the lipid layer and enters through the capillary circulation, and that is how a huge amount of drug can be pasted and it can be released slowly. So demerits is if irritation, so we can't take out the drug but can change the position. So if it is patched in deltoid, it can be patched behind the scapula. So nitroglycerin in angina pectoris and scopolamine for motion sickness. So those who are dizzy when they travel. The next slide shows the transdermal route picture. So when it is patched, the layer enters the lipid layer, then transdermal to the subcutaneous, subcutaneous to the lipid layer, then through the capillary circulation, it enters the systemic circulation. So the last one is topical route of administration. So you all might have when you are suffering from pain, you do Volini spray, and when you have conjunctivitis, you apply drops. When you have nasal block, you do spray, and when you are hurt or when you have injury, you apply creams. So all this are topical. So what you don't know is the vaginal and urethral part, which is most commonly in adults to induce abortion, and in case of infection in vagina or in cervicitis, we prefer the vaginal route. So urethral is when there is phimosis or when there is hydronephrosis due to renal calculi. So this is preferable route. So pessaries can be given. So first one will move to conjunctival, nasal and auditory mucosa. So as we discussed, it's nasal spray, ear drops, nasal drops. So for local effect, and one more thing is the mucosa can be directly land up in systemic effect also. So it is not that if you are asked to spray one spray, you should restrict yourself to spray once only. So if you do pressing on, having sense that it will give you fast relief, it will land up in systemic effect and you will have side effects. So vaginal urethral, so foams, tablets, suppositories, gels are available. So the next topical route of administration is inunction and dermal. So inunction is nothing but when you rub a cream or an ointment to produce particular effect. So that is called inunction. And moisturizer we apply, all this or dermal. So just about newer drug delivery system, having learnt about all the conventional route, it is if I not mention about this newer drug, it will not be fair. So just an outline. So as I said, evolution is a process of human being. So why this newer drug delivery system happens is large amount of drug cannot be delivered to that particular site. So repeated dosage is necessary, and it warrants patient complaints. If the patient is not willing to take four dosage, then the treatment will not be complete. So one more thing is fluctuation in drug concentration in blood. So all these demerits helps few of the scientists to evaluate further route into a newer drug delivery system. So at a predetermined rate over an extended period of time, from a single application, all these benefits through the conventional route can be achieved. So aim is maintain constant blood levels for longer period of time, decrease frequency of administration, improve the patient compliance, and reduce the gastric side effects. So types of newer drug delivery systems are prolonged release parenteral preparation, local drug delivery systems, the targeted drug delivery system. So local drug is if the particular site is affected, the drug will be released to that particular site. And the targeted delivery system is if the patient is suffering from lung cancer, so the particular lung will get the drug, and that cancer cells over there will be destroyed. So some more NNDS are on its way. So inhalational insulin, and this will be dealt in a separate session. So medicine is all about knowledge and skill. So choosing a route of administration or a particular drug depends not only on the knowledge, but how you instill it inside the patient is very important. So having learned about the merits and demerits of individual routes, so I hope you all can choose a better route for the particular patient, and the demerits can be taken as benefit outweigh the risk. So every drug is a small amount of poison that is given inside, but the benefit it has on the patient is most important than the risk. As we have already studied the safety and efficacy of individual drug, route of administration plays an important role in the treatment outcome. Thank you for the patient hearing. Hope we'll join you soon in the next session. Thank you.